Good afternoon, everybody. My name is Pramila Jayapal. I'm so proud to represent Washington's 7th Congressional District. And I want to just start by saying thank you to Chris and Natalie and Felicia and Dorian and all of you for being here and for your vision in really creating the space and bringing together people that are thinking boldly about the ideas that move us forward as a country. And I know that today's event is titled Bold versus Old, but I would like to talk to you about a concept that is both bold and old, and that is universal health care. And in case you disagree with my assertion, just consider the following quotes. At present, the United States has the unenviable distinction of being the only great industrial nation without compulsory health insurance. That's quote number one. Quote number two. Millions of our citizens do not have a full measure of opportunity to achieve and enjoy good health. Millions do not now have protection or security against the economic effects of sickness. The time has arrived for action to help them attain that opportunity and that protection. And the last of these quotes, of all the forms of inequality, injustice in health is the most inhuman. The first quote was economist Irving Fisher in 1916. The second quote was President Harry Truman in 1945. And the last quote, of course, was Dr. Martin Luther King in 1966. So you see, my friends, the movement for universal health care has been with us for over 100 years. And in that century, we have given women the right to vote. We have established Social Security and Medicare. We passed the ADA and civil rights. And we secured the freedom to marry. And yet today, America remains the only industrialized country in the world that does not provide universal health care to all of our residents. Today in America, 30 million Americans are uninsured and 40 million remain underinsured. Our healthcare system today is the most expensive in the world of our peer countries. We spend about 18% of our GDP on healthcare. And that's almost double the cost of our peer countries who all themselves offer comprehensive universal healthcare to their residents. You might think that because our healthcare costs are so high that we have the best health outcomes of our peer countries. But in fact, we have the highest rate of maternal mortality, that's moms dying in childbirth. We've got the highest rates of infant mortality, that's kids dying as babies, and we have the lowest life expectancy of any of our peer countries. And in fact, we're the only country where that life expectancy is actually going down. So how is that possible? What have other major developed countries figured out that we haven't? I contend that what they have figured out is that there are certain essential investments that are required for a healthy society and a thriving economy that can't just be left to the market. And don't get me wrong, markets are great at a lot of things. I don't want to buy my car from the government. I don't want to buy my coffee from the government. But health insurance is one of those things that we cannot leave to markets. Even though people highly value it and are willing to pay a lot for it, the reality is that many others can't afford to pay for it at a fair price, which leaves them with nothing when it comes time to cope with illness or with unpredicted difficulties or with the needs of the very young, the very old, or the most vulnerable. And you see, the private for-profit health insurance markets are not incentivized to serve those very situations. To the contrary, they're incentivized to exclude or deny coverage that might be expensive to the people who can be the most expensive, the people who have pre-existing conditions, the people who need life-saving treatments and procedures. And so left to the private health insurance marketplace, what we see is exactly what we see in America today. And that is a two-tiered, unequal system that leaves out tens of millions of people, leaves tens of millions more struggling with basic insurance and impossibly high costs, and a marketplace that is increasingly geared toward profit and not patients. According to several UC Berkeley economists, it is not likely that the private insurance markets can be made to function well in healthcare, even with aggressive regulation. And so therefore, that's why I'm here with you today, because the only solution is to use the title of this panel to publicize that good. And it's not a new idea. In America, if you lose your job during a recession, our government provides unemployment insurance. And when you reach old age or you become disabled and you can't work, our government provides Social Security. And yet, we have largely left health insurance in the hands of private insurance companies, and when they are faced with the decision on whether to make more profit or to do what is best for the patient, you and I know that the patient always comes last. And on top of that, we failed to regulate the price of pharmaceutical drugs and the cost of healthcare services, resulting in this escalation of costs that seems almost unimaginable. So it's time to transform America's healthcare system. And I've got a plan. Last month, along with Congresswoman Debbie Dingell and 105 additional original co-sponsors in the House of Representatives, we introduced the Medicare for All Act of 2019. And unlike the previous versions of H.R. 676, which was John Conyers' excellent blueprint, vision of what universal health care could look like, it was about 18 pages long, this bill is over 125 pages long, and it is a detailed plan that provides exactly what we need to see, coverage for all Americans by bringing everyone into a streamlined healthcare insurance system that can negotiate reasonable prices and make healthcare accessible for everyone. We build upon the existing Medicare insurance system, and then we expand it to cover more comprehensive coverage. Everything including primary care, vision, dental, prescription drugs, mental health, and more. And there are no copays, premiums, or deductibles in our plan because we actually want you to go see the doctor when you're sick. We don't want you to wait until you have to go to an emergency room, which, by the way, costs a lot more money. We actually want you to get the care you need when you need it. And because universal coverage has to be combined with cost containment measures, we actually include some very important cost measures in our plan. That includes giving Medicare the power to negotiate drugs, and we do that not only with carrots, but also with a stick of compulsory licensing, and then also with movement to a global budgeting model. So for all of those out there who might claim that this is a government takeover of our healthcare system, I want to just point out that our plan continues to use the existing healthcare delivery system. The only thing that changes is the insurance market, the insurance system. Patients will have complete freedom to see whatever doctors and hospitals they might want to see. In fact, they'll probably have more than what they have right now with these increasing in-network providers. They won't have to worry about going to get an emergency procedure done and then ending up with a $20,000 bill that they suddenly can't pay, and now they got to go find a GoFundMe campaign to pay that bill. Our plan also, for the first time, we have included, there's no plan out there that does this as yet, our plan also includes the first ever proposed universal coverage of long-term services for our older Americans and our individuals with disabilities. This was incredibly important to me. This has been a deeply ignored and critical need for our most vulnerable individuals. And in the plan, what we do is we flip the default, which right now says institutional, if you're even lucky enough to get your long-term care because you're on Medicaid and it's only for a period of time, even then, it has the default of going into an institution. And then you have to get a waiver if you want to be in your home. We flip that on its head. And we say the default is to actually stay in your home with the people that you love taking care of you. So this is now, an ambitious plan. And there are some, including some on my side, who say that Medicare for All is too ambitious, that we should take smaller steps, like perhaps a buy-in plan or a public option. And with great respect to all of my friends who have authored those plans, I would just say they do not take on the underlying issue of a broken health insurance marketplace. That is what we have to do if we are really going to require that this common good of healthcare be available to everybody. So let's just talk about cost for a second, because of course this is the first thing. Before anybody knows anything about the plan, they say, what's it going to cost? So I'm going to answer that question, but I want to just flip the question for a second and ask you if you know how much it costs today. What does our healthcare system cost today? Today, we spend $3.5 trillion a year on healthcare in this country. And that number, so that's 35 trillion over the next 10 years if it were to stay constant. But guess what? That number is not staying constant. It is actually escalating enormously. So we're going to spend about $50 trillion over the next decade on healthcare costs as we are. And there is no relief in sight for people who go to bed at night worrying about whether they're going to have to pay their mortgage or pay their cancer treatments. There's no relief for the 2/3 of bankruptcies that happen in this country that are due to medical costs. There's no relief in sight for the people who are foreclosing on their homes or having to beg for somebody else to pay for their healthcare costs. So even the libertarian Koch brothers funded estimate of Bernie Sanders' plan, which is slightly different than our plan, has an estimate that that plan, this Medicare for All plan, would cost $32 trillion over a decade. So that's a concession, and they say it in the report, that we would actually save trillions of dollars if we move to a Medicare for All plan. And our plan, again, is to bring costs down and keep them down. So remember that this new 32 trillion, if you accept that estimate, is not new money, right? This is money that we are already spending in the United States of America. The federal government already pays for 2/3 of costs through Medicaid, Medicare, insurance premium subsidies, and the average American family who purchases healthcare on the marketplace is paying $10,000 a year for their healthcare in those out-of-pocket costs. And if they meet their deductible because they had some sort of healthcare crisis that they had to take on, they're actually paying around $18,000. I just received a letter the other day, and I get these all the time, but here's one gentleman who has a disability covered by his employer, and yet he has health care through his employer, but he paid $35,000 in out-of-pocket costs, premiums, copays, and deductibles. So our plan is transformative, and it is bold. And let's be real about this. Health insurance companies, pharmaceutical companies are going to fight us every step of the way, pouring hundreds of millions of dollars into trying to stop a transformation of this essential common good, this essential public good. Because what we are proposing is a transformation, and it's a transformation of a system that to date has provided a lot of profit for certain actors in the market. I don't begrudge them that, that's what the system has been, but the reality is that can't be what it continues to be. Over $125 billion of profit to pharmaceutical companies, even as people die because they can't afford insulin treatments. We are proposing the transformation of a system that allows that to happen, a system that has yielded over $53 billion in profit to the top insurance companies and take-home pay to insurance CEOs of up to $85 million. So we have a struggle on our hands. And it's going to be a well-funded struggle, and it's going to be doled out to the American people in the form of industry front groups who don't want to see their golden eggs go away. But we've got a secret weapon, and the secret weapon is the American people. Thanks in part to the Affordable Care Act, to Bernie Sanders, who lifted up this issue during his 2016 presidential campaign, and to Republicans who have stripped away what little bit of health care we were able to get through the Affordable Care Act. Americans today know that this is the #1 issue in their lives. And they now believe that health care is a right and not a privilege just for the wealthiest. And so that is why today our Medicare for All bill has unprecedented support. This time around, we were able to work to get a number of major unions on board that haven't been on board before. The AFT, the NEA, SEIU, the machinists, UAW, the steelworkers. We have people on board who represent workers across this country who know this is the right thing to do. Nurses, doctors, patients, the disability rights community, the progressive community, civil rights groups, and women's groups. And yes, not just in liberal districts, but in red and blue districts across this country. We have 70% of Americans with us, including over 50% of Republicans. And that is why on the bill we have a number of frontline members who flipped their districts from Republican to Democrat, who ran and won on the issue of Medicare for All and are signed on to my bill. And I'm really proud to have them with us. And for the first time in Congress's history, I have negotiated with Speaker Nancy Pelosi's support to have hearings on my Medicare for All bill in the House, and that will happen in the upcoming months. We will have this conversation on national television, and we will let the American people from all walks of life tell their stories as we organize town halls and speak outs across the country. So I believe that Medicare for All will also be the defining issue of the 2020 presidential election, and you see it already with the incredible number of candidates who have embraced this issue as their platform. So is it a bold plan? Yes, it is. I think it is, in the sense that our healthcare system is so broken that it needs a transformation. Is it particularly radical? Some would like to call it that, but guess what? This is something that every industrialized country in the world has done except for the United States. So in that sense, it's tried and tested. It's not radical at all. So let me end with this thought. I recently went on my second civil rights pilgrimage to Selma, Montgomery, and Birmingham with the incredible John Lewis, who has been such an inspiration to so many, and saw the inspiration that that part of the country has given us with the struggle for justice. And I've been thinking a lot about one of my favorite quotes of Dr. King's from his I Have a Dream speech. And it's not the one that everybody quotes, but perhaps some of you in this room know it. It is this: "This is no time to take the tranquilizing drug of gradualism. Now is the time to make real the promises of democracy." Dr. King was speaking in large part throughout his life to people who were supposedly on his side, people that said, be patient. We favor an incremental approach to segregation, to income inequality, people who were afraid to make too many waves, that would somehow backfire if they were to take on the power of Southern landowners. He argued then, and also in his letter from the Birmingham jail, that those who refused to recognize the crisis of the most oppressed and argued for gradualism were in fact perhaps our biggest obstacle. He worried that gradualism did not take on the underlying systems of power and inequity that would actually, if we were to just rely on that we would actually fail. That in not taking on risk, we would fail, and perhaps even lead to worse inequality and oppression. And so I want us to learn from this. And I want us to think about the fact that no big change in any society in the world has ever been made by thinking about a small idea to move us forward. And that is the opportunity that we have. We are a great country that has done great things, and we can do this. A common good, a public good for all Americans across the country, and we can do it with Medicare for All. Thank you all so much.